Hello everyone. Today I will talk about pertussis. Pertussis actually is an acute respiratory tract infection that have infect mainly an age between 1 and 10 years. This age will have a characteristic cough that is called a whooping cough. Whooping cough is what this means is an intense cough that come with more than 5 coughs together, and the patient will have a paroxysm of cough that end with a forceful inhalation against a narrow glottis. This type of infection actually have two organisms that will infect a human. These two organisms are mainly is Bordetella pertussis and Bordetella parapertussis. For actually we say the only host will be human, and we say also that the main age is from 1 to 10 years. So some people will ask, will it affect less than 1 year, and does it affect more than 10 years? They both will may be affected. When it will happen to an infant age, they will actually doesn't suffer from whooping cough. They don't have the ability to cough, so they will suffer from apnea. Apnea actually is going to be more worse than the age for 1 to 10 year, because they will suffer from hypoxia, and they could also have a central nervous system damage. So hypoxia and could result in central nervous system damage. Now, the disease actually having 3 stages. The first stage will be what is called catarrhal stage. Catarrhal stage is actually a stage of non-specificity, because catarrhal stage, what will happen there is there will be an increase in nasal secretion. There will be a low-grade fever that actually lasts from 1 to 2 weeks. The first stage. So low-grade fever plus increase in nasal secretion. Now, for the second stage, this is the main stage of the disease. So it is actually the paroxysmal stage. Paroxysmal stage is actually the main part of the disease itself, because what will happen here is the whooping cough. The whooping cough is mainly at this stage. So, and it's actually lasts like 2 to 4 weeks, and causing young children to lose their breath. So here will be from 1 to 2 weeks, and here will suffer from whooping cough, as we said. Whooping cough, and it will last up to 4 weeks. So from 2 to 4 weeks. The last stage will be what is called the convalescent stage. The convalescent stage is the stage of the resolution. So there will be decrease in the symptom and a gradual resolution of all symptoms over 1 to 2 weeks, and the cough become less severe and even disappear. So we will say it is a gradual resolution. Gradual resolution. and it lasts even up to 2 weeks. Okay, so 2 weeks here. So this is pertussis, and still we just like the definition of it. If we turn into the complication actually doesn't involve only respiratory system, So why doesn't not involve just the respiratory system? Most infection actually involve mainly just respiratory system, but here actually the patient will can have seizures, encephalopathy, and even death. Because I don't want to make it so much sad and so much catastrophic disease, but let's be honest, the cough will lead to an increase in intrathoracic and intra-abdominal pressure. And during cough, the baby could have subconjunctival hemorrhage. The child could have subconjunctival hemorrhage, could have even epistaxis because of the coughing, the paroxysm of cough, and the hypoxia could lead to cerebral hypoxemia, and even could lead to intracranial hemorrhage. And all of that, after that cough will end, the child could have pertussis vomiting. Is actually after the end of the cough, he will suffer from vomiting. The severe vomiting could lead to alkalosis and tetany. So the problem, the complication that could happen, I didn't mention all of it because there are many, and I just mentioned part of it. For the treatment, the main treatment should be inside the hospital. So the treatment mainly inside the hospital. Most of children should have admission to hospital, and they should have an isolated, and there will be a dim light with oxygen and avoiding trigger of the cough. And for that should be all inside the hospital. Most of children should admitted. The mainly treatment should be antibiotic, and antibiotic should be the most useful one is azithromycin. Azithromycin that come with 10 milligram per kg per day and for 5 days. That should be given for 5 days. Now, for people they should know that the exposure to someone having pertussis, having a 100% to have the infection, because the infectivity rate is very high, and especially during paroxysmal stage. So because the droplets, when the patient cough and you inhaled that droplet for any reason, you could have the infection even if you are adult, any age. Let's be honest, any age could have the infection. So for protective of yourself, you should also have azithromycin, and for 5 days. A protective measure that anyone had exposure to someone having pertussis. And the treatment for the patient also is not just decrease the severity of symptom, but also prevent her family from get this disease. And the main treatment is the prevention from the disease by getting all vaccination. So please do not, this is the whole message, please don't forget to give your child want him to the primary care to get his or her vaccine. And that's all of it. Thank you.